Good afternoon. This afternoon, or rather this morning, since this morning we have had the pleasure of having the CS for Health, Mheshimiwa Aden Duale, the PS, the MD or the CEO for SHA, Dr. Mwangagi, the acting CEO for digitization. We've also had Dr. Karaoke. Who else is there? Yes. Oh, yes. And the council as well. And also flanked here by members of parliament from Nakuru County and members of the Nakuru County Assembly as well. A lot of our med soups from the various hospitals or health centers across the county. We do have 219 of them. And just our many medics and board members in some of our, in the hospitals. Really today our focus was on SHA and registration and making sure that the people of Nakuru have registered for SHA so that when they come to seek services in our facilities, we are able to treat them and they don't have to worry about paying or about money. In addition to that, one of our bigger issues that we have discussed this afternoon was our regional cancer center that's here in Nakuru, which our Waziri Mheshimiwa Duale has been very helpful in as far as helping us get more equipment in that health center or in that cancer center so that we are able to treat more patients with cancer. In fact, the patients that we treat there are from 24 counties. So it's really big. And from what we have discussed this morning, we have seen that from SHA, when the cancer patients have shift, the reimbursement amounts are really great or much more than what NHIF used to do. So as we stand here today as Nakuru County, and leaders from national government as well as from the Ministry of Health, we are really just excited to make sure that we can onboard as many people in this county as possible, get them in SHA, so that they can get the treatment they deserve or they need with dignity, and so that also the indigents in the county too, we have discussed how as a county we shall be working together with national government to make sure that we take care of our indigents, be they our older parents who are probably not able to make those payments, be they our teenage mothers, be they our street children, just everybody and anybody who is not able to cater for these fees, then we want to be able to make sure that they are able to get into SHA. So anyway, it's been a very productive morning. I was just giving that as an overview, or rather not just morning, but afternoon as well. In here, we have met with our medics, our med soups, our all those people who work in the health ecosystem, and we are just wanting to make sure that as a county, as Nakuru County, we are doing well in the in Taifa care. And I also wanted to say sometimes it's also good to appreciate that as a county, our PGH, as we usually call it, but the Nakuru County Referral and Teaching Hospital is actually #1 in the country in as far as the claims that and the payments made by SHA. In addition to that, we are making sure that we have trained all the other facilities so that they are able to register you. We have a desk as a person from Nakuru County. When you walk into any of our facilities, we have a desk that will help you register into SHA so that we can make sure that we get away from those days where we had to keep fundraising for health services. And as a county, we also, the biggest budget in our county, which is almost actually 30-something%, goes to health. And with what we are also getting from the national government, then we are able to make sure that what the President of the Republic of Kenya, His Excellency, Dr. William Ruto, promised the people of Nakuru and indeed the people of Kenya as far as health, Taifa care, that we are able to make it a reality. So thank you very much for coming. I want to invite the CS of Health, Mheshimiwa Aden Duale, so that he can talk to us a bit and give us a few remarks. Thank you.
Thank you, Governor Susan, members of Parliament from Nakuru County, the CEO of SHA, Dr. Masi, the CEO of Digital Health Agency, the PS Medical Service, entire leadership of the health workforce in Nakuru County. For us, it's a very historic milestone. It's part of what we are doing around counties called the activation of Taifa Care and the Digital Health Transformation Agenda, which are very, very important pillars in achieving universal health care coverage. Through Taifa Care, we want to ensure that every Kenyan can access health care without financial hardship. The integration of the Social Health Insurance Fund, the Primary Health Care Fund, and the Emergency Chronic and Critical Fund is reshaping the health financing landscape in our country because it is inclusive and because it is responsive. The Social Health Authority, which is very central to this transformation, has of today registered 24.7 million Kenyans. They have already enrolled that number. And out of these, over 6 million Kenyans have underwent through the mean testing with an average contribution of 590. That is why the governor is paying close to 40,000 for her Social Health Authority Insurance Fund. That's why I'm paying over 35,000. And that is why Mama Mboga, when she goes through the mean testing, average is 590. So our commitment to make sure that healthcare is accessible, is equitable, and is affordable has come to pass. And this is a very clear sign of public trust in the system. Nakuru County, as of today, has registered 840,386, constituting 39% of the population. So we still have huge numbers to cover in Nakuru County. We have only covered, those who have registered are only 39%. And only a fraction of the registered household have paid their premiums. A lot of people have asked us, how do the informal sector, the salaried people, their contribution is paid by the employer? How do Mama Mboga, how do the people in the informal sector, how do they pay the annual premium if they don't have the money? We have said it, Lipa Sha Pole Pole initiative has brought affordability and flexibility. And I want to tell the people of Kenya, every day between 8,000 to 10,000 Kenyans in the informal sector pay their annual premium. The Lipa Sha Pole Pole is a very progressive, because it tells you if you are to pay, for example, and this I need to make it clear, if after you go through the mean testing and you are told your annual monthly premium is 300, you multiply by 12, it comes to 3,600. Then you pay 4 months in advance. Then the balance you are told, do you want to pay weekly, monthly, or daily? And last night you could see in our system, there are Kenyans who went through that system, and daily they are paying 10 shillings, 15 shillings. And at the end of the day, the system will tell you, pay. If you don't pay that day, the next day you'll pay double, 20 shillings. In Nakuru, we have got 409 healthcare providers who are contracted with SHA. We only have 6 public facilities, but those we have found out are not really under the county, maybe